Hi, today I like to discuss an ECG case. So, like my other videos, I like to discuss everything with a case. So we have a 60 years old man brought into the emergency department following collapse at home, and he denies any chest pain, but with shortness of breath. His past medical history includes hypertension and prostate cancer. So, usually in the clinic, like you already have so many differential diagnoses, like those important stuff like transient ischemic attack or myocardial infarctions are else, but still, ordering ECG is the fastest thing we can do, right? So now we have an ECG here, and for first instant, you can already see from V1 to V2 to V3, we have three so-called rapid year here. So a rapid year is what we means that is a RSR pattern, RSR pattern, which means we have a double R here. And also there's uh not only from V1 to V3, we can see from lead one here, there's a third S-way. Also, let me see. Also, we can find a third S-way here, and also V5 and V6. So, this ECG demonstrate and right RBB red bundle right bundle branch block with our SR pattern in lead 1, 2, 3. So what is the possible diagnosis? So that is why I like to talk about this with a case. Now you know we have our BBB, but what can this case gives us any hints? So it's the shortness of breath. So when there's a shortness of breath and you find there's a right bundle branch wall, what is it? So there's a high chance of pulmonary embolism, PE. So, but in this moment, you will say, "Oh, but isn't that we're gonna see the classic pattern of S1Q3T3?" Yeah, there is, but like once you find this pattern, the specificity is 98.7%, which means very high specificity, and you can just say this is a PE. But at the same time, it has a very, very low sensitivity, which only 3.7%. So it's very unlikely to actually encounter it in the clinic. So still I'm gonna have a quick walkthrough about what is S1Q3T3. So as the name suggests, there's gonna be a deep S-way in lead one. Usually is not gonna be this deep, it's gonna be like this. So we say there's S-way in lead one and Q3T3. So as like as what the name suggests, deep at Q wave and an inverted T wave find in these three. So they are very, very good indicator of pulmonary embolism, but you probably not like very less likely to actually find it in a pulmonary embolism patient. So just remember it. So why you find our BBB combined with shortness of breath just suggests there's a pulmonary embolism because you can understand it from an anatomy. So the right heart, the right ventricle supply the blood to the lung, right? So when there's embolism, let's say like this, it's gonna block the way from the right ventricle to the lung and causing the kind of like the blood kind of like backflow or just stuck here. So it increased the strength of right ventricle. So it causes RBBB. So RBB is like an AV note here. It's the bundle is gonna go like here, and there's gonna be some blockage here, and this is RBBB. and it's very easy to understand. And yeah, so this is the end of my quick ECG share, and thank you for your listening.